Hello and welcome to the continuation of our special coverage of the President's Regional Tours, a production by the Ministry of Information here in Accra, as we take you live to the President's tour of the Upper West and Savannah regions. Well, the President yesterday began his official visit of the Upper West region. It's a 2-day visit, and he has began day 2 of that visit today. Earlier this morning, we took you to the WA Shopping Center where the President inspected progress of work at that facility. It is a World Bank facility, which is a sponsored facility, which is through the Ministry of Local Government. The President has arrived in Issa, the community where he'll be inspecting the Agenda 111 project there. Even before he does that inspection, he's being hosted to a Durbar by the chiefs and people of Issa. And as you can see on your screen right now, the President is attending that ceremony, that Durbar of the people and chiefs, or the chiefs and people of Issa. That ceremony is underway, as you can see on your screen right now. Live pictures from the Issa community where the President has arrived. And ceremony. Shortly after that ceremony, he'll be moving to the Issa Agenda 111 hospital site, where he will be inspecting the progress of work there done so far. Our man Wilberforce Asari is already at the hospital site, the project site, and he will join us shortly with more ahead of the President's arrival in that community. Well, you're watching this live production by the Ministry of Information, and we're live on a number of TV stations: GTV, Metro TV, Adum TV, City TV. We're also on Wontumi TV, Movement TV, Netu TV, Wezo TV. You're listening to us on radio, on Asasi Radio. On Facebook, you're watching us on the Ministry of Information Facebook page. As I did indicate, the President will be moving shortly from that Durbar grounds to the Agenda 111 hospital project site at Issa. And our man Wilberforce Asari is stationed at the project site, the Agenda 111 hospital project site. He joins us now live from the project site with the very latest, even as we wait for the President to arrive at that location. Wilberforce, thank you very much for joining us. So earlier on, you were giving us a brief about what this project is all about. What is happening now, even as we wait for the President to arrive?
All right, Kweku. So we are here at the Damfa Busie Issa constituency, where President of the Republic, Nana Akufo-Addo, is scheduled to make a quick stop to view for himself the ongoing construction of the 60-bed Agenda 111 project here in the Dafiama Busie Issa district. Earlier on, when we did come to gauge the mood here, I did tell you that all is set. All the officials who matter are here in gathered, waiting for the President to arrive and to be briefed on the project, and also get a first-hand feel of how this particular Agenda 111 project is going in the Issa district. I have been thankfully joined by the District Health Director here in the Issa district, Madam Genevieve Yarepare. She's here with me. And then also Ibrahim Issa is the resident doctor here in the Issa district. I'm going to engage them quickly before I speak to the project consultants and also Dr. Isiasare, who is currently on the ground here waiting for the President to arrive. Very good morning to you, Madam Genevieve.
Good morning.
Thank you very much for joining us on this production, and a very good morning to you, Dr. Issa.
Good morning.
Indeed. So I'm going to start with Genevieve. They say ladies first. So let me start with the lady. Please bring us up to speed. What is the state of healthcare here in the Issa district?
The Dafiama Busie Issa district is one of the 11 districts in the Upper West region. The Dafiama Busie Issa district has a total of 29 facilities. We have the polyclinic. It is a health center and recently being upgraded
Aman Wilberforce-Sari will join us shortly with that particular interview, but you're seeing pictures live from the Issa Agenda 111 project, hospital project site, where President Akufo-Addo is expected to arrive there to inspect ongoing the inspection of the Agenda 111 project in the Dafiama Buse Issa constituency will take place, as I did indicate. The seat is located within the Dafiama Buse Issa district of the Upper West region. Just as Wilberforce informed us earlier, the current member of parliament for the area is an NDC MP who is Sebastian. It's in the western. Its western neighbor is Nadoli Kalio district. Don't forget that is the district the president will be moving to commission that. So Wilberforce is back.
Along the line, we had a little bit of a challenge with the sound, but Kweku, I believe that our sound is pretty better now. Indeed. All right. So I'll come back to Madame Genevieve and for her to give us a rundown of some of the issues that she was talking about. She started telling us about the state of health here in the Issa district and also other details. So if you may continue from the details you were giving us.
Yeah, so the Dafiama Buse Issa district, as I said earlier on, has 1 polyclinic, 4 health centers, and 27 CHIP zones. And 20 out of these CHIP zones have compounds where nurses stay or health staff stay to provide both curative and preventive services. And as mentioned, whenever there are cases that are beyond the CHIPS compound, they refer to the health centers or the polyclinic. When services or special client that needs specialist services cannot be managed at the polyclinic level, then we have to refer to the regional hospital or the Nodoli Kaleo district hospital. And sometimes these referrals sometimes affect our maternal and child health services and other specialist services. So the 111 being planned for this district is in the right direction, because when it's completed, we will have doctors, we also have specialists that will be able to manage these cases that cannot be managed at this level, and they will improve on our health outcomes.
Indeed. So that's Madame Genevieve, and she is the district health director here in the Issa district. Let me come to Dr. Issa. Your name Issa, and we are in Issa. So interesting. You are an indigene of this locality. I should think so.
No.
Okay, so where are you from?
I'm from Wa.
Oh, you are from Wa. Okay, so not from Issa, but from Wa. Okay, indeed. So from the practice point of view, you have been practicing medicine here, administering health care to the people of Issa. From your point of view, what would you say is the state of health service here in the Issa district?
I think the extent of practice in terms of around here is very limited, both in terms of personnel and then logistics. Like my director rightly said, we serve as the main referral point within the district. Again, because it was just a health center and then we managed to upgrade it to a polyclinic, it means that we lack a lot of equipment and then personnel, human resource personnel as well to support. So it's quite challenging, because sometimes you have the skills to put in certain interventions, but due to lack of equipment, you are forced to refer. At the end of the day, it affects our performance as a district and as a facility. Yeah.
Okay, so from what you are telling me, the coming into being of this project and as the Agenda 111 project, which is at the initial stages of construction, to what end do you think it's going to influence practice here in Issa district?
Yes, I think its importance will be tremendous. You can't possibly quantify, because then it brings a lot of relief to the indigenes, and then it makes the work a bit easier and enjoyable for the health personnel around here too. Because as I'm told, it comes with fully installed equipment such as theater services and other services. So it means things that we previously used to refer to, cases that we used to refer to the original hospital in Wa, with the coming to being of the hospital, certain key health personnel, doctors and then others alike, and then it means that we will to render all these services to the people, and then it will help improve the quality of healthcare in the district.
Indeed. All right. Okay, cool. Dr. Issa is essentially telling us that the Agenda 11 project here in the Issa district, once it comes into being, has the potential to stop referrals from here in Issa all the way to where we came from this morning. It's about nearly an hour's drive from here to Issa. And so that tells you that when a referral has to be done, the person has to travel nearly an hour, and part of the road not too good. Now, when this hospital comes into being, potentially those referrals will stop and people will receive direct health care here in the Issa district. Let me come back to Madame Genevieve and to ask you that from what you have seen, what would you say are the major health challenges that people in this area report to your hospital with?
Currently in our setup, we have maternal and perinatal deaths within the catchment area because of access to specialist services. We also have challenges with critical staff manning the various facilities that we are running in this district. In addition to the transport is a challenge, and the basic equipment that we need to provide services. One of the issues, as mentioned earlier on, is the specialist services, where because of the demarcation of the district, sometimes the referral to the next facility is delayed, and what we need is more facilities like the Agenda 111, if it's completed, to support with referral issues, which actually have a lot of effect on our mothers and children's health. Also, we have also observed that within our catchment area, when it comes to location of the CHIPS compound and the access routes to some of the communities, is one of the areas that have improved but still needs a lot, because we have 5 communities that are hard to reach, and these also need to access services, and sometimes they have to struggle to reach the polyclinic and still have to continue to the Upper West Regional Hospital for services. So if the Agenda 111 is completed, then the distance will be reduced for such our people who are coming from far away, especially how to reach communities. So we'll be grateful if this beautiful plan that has been put here is completed, to at least for people to benefit and for us to also reduce perinatal deaths in our catchment area.
Okay, so Madame Genevieve talking about the fact that this project is essential and all that. So, Doc, you know, the population and housing census 2021 indicated that there are about 38,754 people in Issa alone. From where you sit as the practicing doctor, what's a typical day like in your hospital? How many people are you having to attend to on a given day? On
an average, you see between 1,500 people a day at the OPD. That's aside the maternity and then the inpatients. So yeah, so on average between 50 to 100. And then sometimes, again, like I said, because of the lack of personnel, sometimes it's very difficult to expedite the services to these people, because sometimes you have to first of all review inpatients, come back to the OPD, and then do with other activities, workshops, meetings alike. So sometimes it hampers the quality in care, because then a lot of the times either you are trying to rush one or two things, or you really don't have the patience to go into certain issues the patient will come with.
So the current hospital where you serve, what's the name again, if you could just tell us?
It's a polyclinic.
It's a polyclinic. Yes. What's the name?
Issa Polyclinic.
The Issa Polyclinic. Okay. So Dr. Issa working in Issa and working in the Issa Polyclinic. So how many beds is there? Are there beds in that particular polyclinic?
Yes, we have about 30 beds.
30 beds. Okay, so what it means is that if Agenda 111 is completed, we are going to have 90 beds because this is a 60-bed facility and all that. All right, I'm sure that as we exit this interview, I'm very sure that if I brought the project consultants here, you will have a specific word for them. What would be your word, Madam Genevieve, for the project consultants and contractors here, to them, your word directly to them as far as this project is concerned?
That they should complete this early for us to use it to improve access in the Dafiama-Busie Issa district.
How early do you want it? Tomorrow?
Today.
All right, Madam Genevieve wants this project completed today. I was thinking about tomorrow, but she says today. Doc, how about you? Yesterday?
Yesterday.
So, Doc says that he wants the project to be completed yesterday. All right, so I've been speaking to Dr. Issa. He's a resident doctor here at the Issa Polyclinic in the Issa district. And then Madam Genevieve Yeripari is the District Health Director. Thank you very much for speaking with us. As I exit with you, we will come back now and speak with the project consultant and then also the Presidential Advisor on Health, Dr. Issa Asare. They are going to be giving us some updates as far as this particular project is concerned, as we await the arrival of the President of the Republic, Nana Akufo-Addo, who I can tell you is already in Issa, where he's meeting with the chiefs and elders in Issa, together with the community EBA being held in his honor. As soon as he finishes, it's just about 3 minutes drive from the Deba grounds to the facility where we are, and President Akufo-Addo will be here. He will be briefed by the project consultants and also by other officials who are herein gathered. So thank you very much, Madam Genevieve. Thank you very much, Dr. Issa, for engaging with me. I'm going to receive Dr. Issa Asare and also the project consultant, Mr. George Rekubrobe, I should say. So as they walk to me, let me tell you that we're bringing you this live coverage from the grounds here at the Issa district, where one of 5 Agenda 111 projects, which is taking place here in the Upper West region, is being constructed. From behind me, you can see the project ongoing. There are people who are working, all of them in the requisite clothing with their hats and all that, protective gear, to ensure that casualties are minimized. I've been joined by Dr. Issa Asare. Dr. Issa Asare, Presidential Advisor on Health. I will also be joining Zone 5 Project Coordinator. Now, Zone 5, because here, as far as the Agenda 111 projects are concerned, the project consultant telling us that they've zoned all the 111 projects into 8 different zones. Mr. George Rekubrobe here is the one in charge of Zone 5. And Zone 5 consists of the projects that are under, or the projects that are taking place, being constructed in the Wa region, the Upper West region, I should say. So thank you very much, Mr. Rekubrobe, for joining us.
Thank you, thank you.
And then also Dr. Issa Asare, thank you for joining us.
Thank you and good morning.
All right. So yesterday we had a conversation with this same gentleman at the Lambusie site of Agenda 111, that up north, up the upper part of the upper. Now we are more so perhaps in the middle belt of the Upper West region. Mr. Rekubrobe, tell us, what is the state of affairs here as far as the Agenda 111 project is concerned?
Well, currently the contractor is at the substructure level. They've done some isolated columns and the ground beams, and they are here to do the filling. So we're looking to say they are about 12% construction phase.
So about 12% complete. That means that about 88% to go.
Yes, they have some challenges with regards to procurement of materials, like the chippings. And of the volume of contractors that want the same product, they are restricted with regard to the amount of purchases that they can make. So sometimes they are restricted to buy just a one trip or two trips at a time. I think the recommendation is that they should come together and procure those materials in bulk on site so that it can help them speed up the progress.
So that would mean that thinking about the contractors who are doing the work for your zone, the zone 5.
I'm talking about contractors for this particular site, the Issa site, yes.
When you talk about the fact that you think they would have to come together and buy their products in bulk,
yes.
Who and who are coming together? That's what I want to establish.
Oh, there are 3 contractors on this particular project. I think it's Rama, there's Monjori, and then there's a third one, I've forgotten the name. Yes, so are the 3 contractors supposedly on this project.
Okay, so you are suggesting that the 3 contractors who are working on just this project should join forces and buy their materials. It will help speed up the process. Exactly. Indeed. All right, I'm going to come back to you. Stay with me. Let me come to Dr. Ahead of President Akufo-Addo's visit, you are his advisor when it comes to issues of that. Means that this Agenda 11 project, you are very much involved in the putting together of the vision and all that. Tell us what you have seen here today ahead of the president coming. Are you impressed? Do you think that we need to be speeded? We need to speed up a little bit. What are your first-hand impressions?
I'm slightly disappointed of the amount of work done here. This morning, when I came here, we have spoken to all the contractors and we've asked them to speed up. This Agenda 11 project has timelines to finish it as quickly as possible, and as the president said, he wants to commission them before he leaves power on the 6th of January 2025. I believe that they can at least hasten up a bit. Consultants said if it is materials, they should all get together, get the material in bulk and bring to site. This is a project where I have at least giving 10% mobilization to all the contractors who are started. And I believe that they should use those mobilizations to get enough material and then work very fast. If you look at this place, it's not like that where we have hilly areas where they have to cut and fill and all flat land. So they should have gone faster than what we have seen here. Okay, despite what their constraints, I don't believe that the constraints should be a factor for them to do only, how many? Is it 12%? They should be more up to 50% by now, because they started in January, 5 months is gone, and every contractor has, some of them have 8 months to go, total construction period. The main contractor has about 15 months, and if 8 months is gone and we have of the job, then it's a bit worrying. That's why we are here. I'm happy that the president is going to ginger them up, is going to put a lot of pressure on them, that project.
Okay, so Dr. Issa, not missing words, indicating not too excited about the progress of work here, but he's also assured that once the press come in here, it is likely to affect the output going forward. But let me stay with you, Dr. Issa. From where you sit, responsibility on you and also on government to whip up the process. What will be the strategy that you think you would adopt to whip up, particularly for the local contractors who are working here, the indigenous Ghanaian contractors? What is the strategy to whip up their work so that their output will be comparable to what we are hearing in relation to the contractors who are not so indigenous, who are perhaps out of the Ghanaian space?
Yeah, what we are doing is that we already, after we visited the 3 northern region, Upper East and Northeast region, last week, Wednesday and Thursday, we met the consultants. We met all consultants, the representatives of all the 8 consultants, and we told them what we saw. We went to the 3 regions and what we've been seeing in the that they've been giving to us. And we didn't mince words, that we will not shy away from cancelling or terminating any contract which is not going very well. Luckily, most of the sites, they are about 2 more than 1. Some of them have 3, has 4 contractors. At some sites, some are going faster while the others are dragging them behind. So it is very easy that asks the other people who are there to continue doing the job for us and finish as quickly as possible. What we're going to do when we go back to Accra on Thursday, next week or next 2 weeks, we are going to call all the who are not doing well, all the consultants. The two of them will sit down with us for about 3 or 4 days, and then we find out what the issues are, and solve the issues, and also admonish those who are not doing well, and then ask them. The next thing that we are doing is that the consultants have written to us. Those who are, a few of them who are not, and letters have gone to them. There's a letter, they normally contract write about 2 or 3 letters. Some of them have gotten about 2, 3 letters. So we are not, if somebody is not pulling the weight. We believe that this is a way trying to make our local contractors also come. But sometimes you see this, and if you look at sites that we go to, the caliber and also the people who are on site, we encourage them, and the consultants are doing very well to encourage them to employ Ghanaians, Ghanaian architects, Ghanaian quantity surveyors, Ghanaian engineers. They are all in the place, and there are a lot of people who are looking for jobs to do. So I believe the people who will do the job. I believe that if you put the money where the money is supposed to be, job can be done and be done in a record time. And that's what we are going to do. We are going to crack. And those who have to be whipped, we whip them into life to finish this construction as possible. We gave ourselves, this construction site should not last for more than 18 months. Maximum 15, maximum 18 months, depending upon the work. And I believe that if you start the contract about 8 months ago, you have only 10 months to finish. And there is no way that they shouldn't finish work. What I understand is that the most difficult work is the substructure. Structure is done, the pillars comes up, you can put the beam and then put the roofing. Then during rainy season, when the roof is on top, that's the advice you have given to the consultants. That also will give to them on the site that this is what they should do.
Okay, so Dr. Issa, from where he sits on government circles, they are going to crack the whip. If you may turn and face from the project consulting point of view, what are you going to do in some efforts to crack the whip so that your contractors who are working under you get on the job and get it done, particularly the local contractors?
Yes, like we had a meeting with the HIG consortium, and they told that that we're not happy with the current performance of the contractors. We've also had separate meetings with the contractors, and in a few instances we realized that the requisite personnel, the qualified requisite personnel that are on the project, them to give us updated CVs of their current workers on site, so we make sure that all those people who are on field are qualified to execute the work. And we've also discussed with them things they should put in place for the works to speed up. Like I just really conversation about procurement of materials, and we hope that this should help speed up. Of course, we've also cautioned them that we wouldn't hesitate to write termination letters. It's important if it's critical. So these are some of we would help set them up, and like Doc was saying, we wanted to encourage contractors, so that's why we've engaged local with regards to this Agenda 1.1 phase. And so we're hoping that with this measures place, both the one that Doc has mentioned and the one that is coming from our end, we get the project in full flight.
Okay, so Kweku, Doctor in with me, and so is Mr. Charles Kweku will also stay with me. But George Kweku, I'm sorry about that. Now, if you're just watching us, this is the Ministry of Information production with a live coverage of President Akufo-Addo's tour of the Upper West region. Today, Addo has made a stopover at the Wa Shopping Center, where he inspected the ongoing process. He is currently in the Issa district, where he is being held with the Deba of the chiefs and elders of the Issa district. After that, and his entourage will drive here to the Issa site of the agenda, where he's going to be briefed on progress of work and also processes that are going to unfold after his visit today to ensure that this is completed within the timelines. We've been speaking with Dr. Issa. He's been telling us that he's not too excited about the progress of work here on this. He believes that with the president's visit, it will whip up interest so that we'll get to work and complete the process. Dr. Issa again tells us that this office is going to be organizing a meeting between them and the project consultants together with the contractors going forward to ensure that particular local contractors who are involved in this, when we say local contractors, we're talking about indigenous Ghanaian contractors, after receiving their 10% mobilization fees more effectively than this, so that Agenda 111 can be 111 of such projects taking place in our country. And to Dr. Issa, because beyond this particular one that he has clear on, before we came here, you showed me some pictures of some that, in your view, are doing very well. If you could just give us a brief of these projects, where they are, and what the other contractors can lend other persons whose projects appear to be doing better than theirs.
Up north, in the Upper East region, if you go to Garu, you go to Binduri, a lot of the work going on there is fantastic. And go to where even we went to yesterday at Lambusi, and we have also been receiving pictures from other zones. Work is going on. Some of them have reached lintel level. Some of them are even about to roof. And now, not what we are seeing here today, that is mainly the substructure is not even finished. By now, the substructure should have been finished. The pillar up, and then even some of them have reached lintel level. That's what we want to see. To add quickly, there are some of the local contractors who have also gone very high. If you go to Biru, they are foreign contractors. Even areas where they started work, as late as see the amount of work that they've done when we met the consultants last week, Wednesday, it's fantastic. And that's the way that we have to go. The press wisdom wants the local content to be deepened. And I believe that if the local listening to me today, we'll be going around, even after the president has finished, we'll be going around of the consultants regularly to make sure that we whip everybody. As the consultant said, if we are not doing very well, we will not shy away letter and give it to the other people. As I speak now, over 220 collected their mobilization, 10% mobilization. So any contractor who has mobilization, if he's not on site, it means he's not interested in the work. Period. Right. You should also have gone further than what you are doing. So I want the contractors today that those who have maybe received some warning letters and all this to the site, those who have not received and they are doing well, they should continue in there. But we are not going to sit down until this project is completed.
Okay, so when it comes to finances, beyond the 10% mobilization, is there a specific or a certain kind of model you work with to provide these contractors with the that they need for purposes of executing these projects?
It's in construction. You're giving 10% mobilization, you work over and above the 10%, you interim payment certificate, and then you are paid. I think we have paid another interim payment certificate, those who are doing very well. If you bring it, consultants look at it, it goes of the job that's a hospital infrastructure group, comes to the office of the, and then you'll be giving your money. So far, anybody who has presented a certificate, as we speak, paid. So we believe work, and once you work very fast, and then you bring your certificate for you to continue. And some of them are doing very well, fantastically well. Some people even got their mobilization. And after the mobilization, they push it into the work, and the work.
So is that essentially, Dr. Issa is saying, if I get him right, that determines your input. So when you put out, then you receive the EF to be able to continue with the work. Okay, so Mr. Konsana, when the president arrives, essentially, are you going to tell him? I've seen that you've erected the project. Is it designs and architectural impressions? What are you going to be telling when he's here?
Well, I'm going to inform the president that the performance currently is not as expected. Had consultations with the constructors, and that they're going to increase their working, increase the labor strength on site, and hopefully, where necessary, and we'll get the project up and doing within the.
Indeed, thank you very much, George Reku Brobe. He's a project consultant for Agenda 111 group of hospitals that are being built. And then Dr. Issa Sare is the presidential advisor on health. We are all here on strict grounds where the Agenda 111 project is being constructed. You can see behind me, maybe let's pave the way so that people can see behind us. This is the project site. Earlier on, when I took a trip, I saw that the project contractor has demarcated all the specific places, all the various buildings that are going to be, in terms of the maternity ward, in terms of the lab of outpatients department, and what have you. All those demarcations are on the ground. You see that the work is ongoing. However, there is so that it is delayed, particularly here, but the officials involved in the process excited about the president's visit, and they are anticipating that after, and with the brief they are going to give the president, together with the presidents of the presidential advisor, going forward in the next few months, there's going to be a lot of whipping the people involved in the construction of Agenda 111 projects to ensure that the timelines that they have by those who are fronting this project or promoting the president himself all the way to all officers in his office as far as health issues, they will whip these contractors into line to ensure the project is delivered. Dr. Nsiasare tells me that President Akufo-Addo wants to finish these projects within of his presidency, which is left with about commission them. Okay, which is left with about 2 years and a few months. Are we sure that this will be achieved?
Very certain that it will be achieved. You see, if you look at the work left, it's not any different. It's not a story building. It's a one-story building. The substructure is done. All what is done is the pillars will be raised, roofed, demarcate, and the equipment will also come in. Equipment is going to be better. And the personnel to work in have also been so that we start employing the people, giving them financial clearance. You see, but one have to tell you, coming here, if you look at the essence and the vision of the president, Agenda 111 is being done, you see that at this area, it's more than the most important thing to be done here. There's one doctor who is working at the Eze Health Center, and I'm very happy when I man at this area working here. So we have to put
Dr. Issa, yes.
So we have to put up this hospital. Let Dr. Issa and other doctors, the regional area, put in the personnel here, so that we reduce the number of referrals from here to regional hospital. That's the essence. It's the first referral center district for the DBI district. So once it's done, then we are then moving forward as a country, because what it means is that we who are very near health should come near to the people are. That's exactly what we are trying to do. And to me, this is what the president, and this is the most important thing the president has done for this nation after.
Indeed, Dr. Issa Sare is the presidential advisor on health. President of the Republic, Nana Akufo-Addo, has arrived here at a facility where he's going to be inspecting the project. His vehicle is just pulling over to the officials have gathered. His ADC has just gotten out of the vehicle, will open his door, and President Akufo-Addo will step out, and then will subsequently proceed from here to Kalio, where President Akufo-Addo will be commissioning the Kalio solar. And so President of the Republic, Nana Addo Akufo-Addo, is out of his travel, and he is exchanging pleasantries with the project officers, and will subsequently be briefed by the project manager. Yes, President Akufo-Addo has finished exchanging the pleasantries, and his officials will now brief him project activity. Yes, so President Nana Addo Akufo-Addo is currently being briefed on the project and being given first-hand information as far as the district hospital, which is the Agenda 111 hospital, is called. I will go a little closer. So, okay, all right. So let me be there to engage the process. But President Akufo-Addo is the project consultant, is currently speaking to him and giving news of this particular project. Earlier on, when we spoke to the project consultant, to the presidential advisor, Dr. Issa, they have is that this project is a little behind schedule. Indicate to us that the contractors here need to be equipped so that they can do more work beyond what they are doing. This particular site work began in February of this year, and so March, April, May, June, July, August, that is 7 months into this project, and the officials, this project should have gone beyond the level that it is right now. They are saying that now that the president has come here, it is for those who are contractors, 3 contractors who are working on this side. Of the president's visit, shore up their activity to ensure that when it has an opportunity to come here to the Issa site, they're able to confirm that work has been done properly. In your short, is President Akufo-Addo being briefed about this particular project, together with his traveling officials. All the officials from the presidency he works with are here, making sure that he gets a good briefing. And so the project consultant, Mr. George Rekubrobe, is briefing the president about this project and to ensure that he gives him first-hand information. This is a live broadcast of President Akufo-Addo's tour of the Upper West. He has been to the town center here in East, where he engaged with the chiefs and elders, and then he has proceeded to the Agenda 111 grounds here at the Issa district, where he's been given a briefing about the project, which we are told is about 12 complete. The officials are telling us that from the start time of this project to date, percent or 11% is a little low. They are hoping that with the president's visit, it will beef up the process, particularly with the 3 contractors working on this site, so that they can do a bit more work. Timelines for most of the Agenda 111 project is 18 months. From all intents, this particular site, the contractor has 10 months to complete the process, and he is yet to finish with his foundation. We are told that that foundation is almost complete, which is the most important part of the work. You get your subs completed, then lifting the building big part. Yesterday, when we went to Lambusie, we gathered that the in Lambusie is completed, and so it is now left with raising to its lengthen level so that they can be roofed. Hopefully, with President Akufo-Addo's sites, having chosen these 2 sites in this region, which has 5 Agenda 1 sites, it will become the underlying current, beef up the efforts of the contractors so that they can do this work. President of the Republic, Nana Akufo-Addo, is in your shot. He's been giving a briefing of the Agenda 111 project is here at the Issa constituency. The project consultant, together presidential advisor on health, Dr. Issa, when they were speaking with us earlier, that they are not going to be holding brief for any contractors and go according to the strict timelines associated with the Agenda 111, if that it would not be beneficial to the state nor beneficial to the districts where these projects are being done for any contractor to be shielded, to be shielded by the state. If you are not doing your work well, you'll be called out, you'll be instructed to do better. If you are not doing as better as, then they will be forced to crack the whip by taking the project from you and giving it to another person who is ready to timelines that has been set by the state. So this is extremely clear. It's extremely important that the contractors who are engaged in construction of Agenda 111 projects take heed to the caution that has been issued by the presidential advisor and also by the Zone 5 consultant who is in charge of all the projects that are taking place in the Upper West region as far as Agenda 111 is concerned. And so President Akufo-Addo is the briefing is detailed, I'm being told, from the council. The president himself is concerned about the current state of it, and so he is asking questions and making sure that he can get answers the project status. I've been joined by midwife. Yes, please tell us your name.
I'm Grace Yendo, the midwife in the Issa College.
Okay, so your name again?
Grace Yendo.
Okay, so Grace, Auntie Grace, you have been here since we started. I've spotted you. I'm told that one of the issues that you deal with a lot here in your 30-bed polyclinic are the issues to do with maternal health issues.
Please.
Okay.
We have issues with maternal health issues as well as issues.
Okay, so now that this agenda kick-started, to what extent do you think the project, once completed, work you do here in the Issa district?
I think people here greatly, in the sense that the polyclinic are the only referral center for the whole district, with only one and no anesthetists at the moment. We have a theater, but the unavailability of the anesthetists, we don't do that cesarean session for our mothers. We mostly refer them, and the referral to the private road network is an issue. Ambulance services, when you are referring financial as how they are going to be referred, they are all issues. So if this, I believe it will go a long way to help us in our service delivery as maternal and child health issues are concerned. The theater will be operating, coming here, more logistics will be given, and I believe that maybe acts like gynecologists and obstetricians with pediatricians, they will all be available, and I mean it will improve the health of the people greatly.
Indeed, I'll be speaking to Madam Grace. Madam Grace is the midwife here at the Issa, the only hospital in this particular district. So you are looking for Agenda 111 project. Are you in consultation with? Are you in constant consultation with the people who are I know that the district health director will by all means be involved in the process. From where you sit, what is the kind of engagement that is going on between the hospital and the contractors to this project quickly?
I think that relationship is there, where that they will continue to expedite action on the so that it will be completed in time. To help in so many ways, like the referrals will be limited, and most of our help is attended to here. So I believe we are working hand in hand with this thing come to a fruitful.
Indeed, I've seen that the of Issa has joined President Akufo-Addo here on the grounds for the purposes of the inspection which is ongoing. So the project consultants are now not only briefing President Akufo-Addo, but they are also briefing the chief of the area. So he also gets first-hand information as far as this project is concerned. So that whilst President Akufo Issa and goes back to Accra to continue his work, the chief, who obviously some kind of attachment to his people, being the chief of the area, will be in touch with the project consultants to ensure that the project is executed. And so this is a production of the Ministry of Information, and we knew a live coverage of President Akufo-Addo's stopover at the Issa version of the Agenda 111 project. So Issa is one of districts in the Upper West region which is benefiting from the 111 project. Yesterday, we went to Lambusie, where President Akufo-Addo got a briefing of the state of the Lambusie version. I can see that President Akufo-Addo's ended, and the chief who came to join Mr. President for this briefing is also departing. President Akufo-Addo is now making his way back his vehicle so that he can leave this premises and go all the way to Kaleo. Kaleo is about, let's say, about an hour from here in Issa. There, President Akufo-Addo is going to be commissioning the Kaleo solar power project, the most important project, we are told, that has taken place in real time, and President Akufo-Addo is heading there. I'm being now by the DC for the Issa district. Is that correct?
Yes, the district is Dafiama Busie Issa.
Issa. Yes. Please tell us your name.
My name is Imoro Sanda.
So Imoro Sanda, thank you very much for joining us. You were part of the president. What did you hear the project consultants telling Mr. President?
Project consultant was very assuring with respect to the completion of the project. For me, that is the most important. He said even though they are a bit behind schedule, their contractor, how they will catch up with the percentage lost. And for me, his explanation, I have bought into it.
Akufo-Addo say in response to what he was told?
He was also happy by the assurance the contractor gave, and he also reiterated the point that government is very serious about these Agenda 111 projects, going to sleep by provide the needed resources to resource the complete the projects on schedule.
I see that the chief of the area joined.
The permanent chief of the Issa joined the inspection of the project.
If you his name to us,
he is Na Yeluku Ang the second.
Okay, so now so he joined the briefing. Did he also express any?
This chief, this is not the first time he even came here. When this project started, I quite remember one of our General Assembly meetings. He joined me together with our inspection, and all he said is that this project is very dear to the Issa people. Don't forget, proud to coming into office by the MP in 2017. This district had neither a district hospital, and all referral cases were either to Nedoli or to Wa. In 2019, when we upgraded the then Issa, actually downgraded to a church compound, to a polyclinic status. God being so one of the Agenda 111. And so the chief and the people of the Fiumbuse Issa in general are very happy with this project. It is I have to join the president to inspect this project.
Indeed, Kwekuso we will see for the area, and he's also been telling us the briefing the president joined by the chief, and then also subsequently expectations are. All right, so apart from, quickly, just to engage you before we exit, from this particular project which is taking place here, Agenda 111, are there others of concern that are taking place here in the Issa district?
Yes, with regards to health, and if you care to know that this has initiated another project to upgrade the center into a polyclinic. The same thing can be said about Kajukiri Health Center. Number of projects which are ongoing, and the plans is that to upgrade these health centers to polyclinics. We've not forgotten of the Fiang and that of Busse. Besides that, the district assembly and the government, we're still working on providing all other infrastructure that you need to improve health. The district had no health insurance office on its own. An extra modern health insurance office complex in Issa is about 95% complete. By 2-3 months' time, we will establish a health insurance office here, so that people can go there, renew their cars within the district, so that they don't have to travel outside. And so, delivery system, this government has done its best.
For your thoughts. Thank you very much, the DC. So this has been our coverage here at the Issa district, where President Akufo-Addo came to inspect the Agenda 111 project, which is ongoing here at the Issa district. We are told that the project is delayed a little. However, there are assurances from the project consultants that the project will be executed in time. My name is Wilberforce Asari. I will hand over back to Kweku in our studios as we move to Kalio for the commissioning of the Kalio for the commissioning of the Kalio solar power project. So Kweku, over to you.
All right, thank you very much, Wilberforce Asari, live from the Issa community, where President Akufo-Addo has just inspected the work ongoing there on the Agenda 111 hospital project. And as you did hear from Wilberforce Asari, the President and his delegation are now heading to Kalio for the commissioning of the Kalio solar power plant, which is also in the Upper West region. Just to give you a little bit of a background to that project. So the solar power plant is a 13 megawatt plant, which is in the Nadole Kalio district of the Upper West region, and it will provide power to some 32 households. So that's a big deal for the region, and we will be there to bring you more once the President arrives at the scene to commission the project. You're watching our special coverage of the President's regional tours, a production by the Ministry of Information, live from Accra. We are with you with the President in the Upper West region. Later on this week, we'll move to the Savannah region, where the President will wrap up his tour for the week. Where you're watching us live on GTV, Metro TV, City TV, Adum TV, Netu TV, Wezo TV, and of course Wontumi TV, and you are also listening to us on Asase Radio. You've been watching us on the Facebook page of the Ministry of Information. We will go for a break. When we come back, we'll be live in Kalio, where President Akufo-Addo will be commissioning the solar power plant. Do stay with us. My name is Kwaku Obienje. We'll be back with a Kalio special coverage.